Jen?
Thank you very much, Rebecca. So from a baby's first dentist visit to making sure that the kids really remember to brush their teeth, even when they're saying, but Mom, I don't feel like it, like my kids do every night. Starting your child off with good dental care can really help protect their smile for decades to come. Joining me now is pediatric dentist Dr. Stephen Cochran. Good morning to you. Thanks for being here. I appreciate it.
Thank you.
You know what, this is always such an important reminder, because I think one of the things that we also have to be cognizant of is the fact that health insurance is there are some families that struggle just with that. The dental care may not be something that people can afford. So this is a good reminder for them when they're watching on what they need to know with their kids. So let's start with age if we can. At what age should you be brushing, even if it's just maybe with your finger?
It's a great question. The American Academy of Pediatric Dentistry recommends brushing the child's teeth right at about 6 months of age when the first teeth begin to erupt. And typically, you're going to use an age-appropriate size toothbrush. We've got a couple of samples here. And typically, this is the infant-style toothbrush right here.
And it's clearly marked, too, because it'll give you, because if you're not sure, I mean, you walk into the store, and there are so many different options, you just don't know what to do.
Toothbrush and
so you trust,
right
then, what's listed as the...
Correct.
And should you always do soft, then?
Correct. I would recommend using a soft bristled toothbrush. And as far as the amount of toothpaste, you should actually begin to use a fluoridated toothpaste right when the first tooth erupts. And typically using about a rice-size amount of toothpaste on the toothbrush, smearing that toothpaste into the toothbrush bristles. And as the child moves on to about 2 years of age, using typically about a green pea size amount of fluoridated toothpaste.
So you don't need to, because you see it in the commercials.
Correct.
Selling the toothpaste, right?
Yeah,
that pretty little, whole line that goes all the way across. You don't need that much toothpaste.
That's absolutely correct. You want to avoid that amount. Again, for an infant, usually up to about 2 years of age, just using a rice size amount of the little fluoridated toothpaste. After 2 years of age, going to typically a green pea size amount of the fluoridated toothpaste.
And then as they get older, then, because there are different kinds of toothpaste,
Correct.
When should you start using, if you want that whitening and the hydrogen or the peroxide and the baking powder? I mean, it gets so confusing when I'm in there, because I don't want to do something that's too abrasive that hurts their gums.
I would stick up to typically maybe the teen years with typically the children's style the children flavored toothpaste or the basic Crest or Colgate. Going into the whitening toothpaste and such like that, I would probably wait till maybe after braces, maybe in that 13, 14-year range. And I would also, as far as toothbrushing, I would typically recommend that the parents supervise the child with the toothbrushing up to about 8 years of age.
And that's
important,
important,
that's very
too.
important.
That dexterity, making sure that they get back to those molars, because really where you're going to start seeing the decay is on the molars, right? Not really so much on the front teeth, unless there's some kind of periodontal problem.
And that is correct. Now, leading into that, we do see a high incidence of cavities in the younger children in the 1 to 2 range if they're put to bed with the baby bottle or excessive nursing on demand. So typically, the American Academy of Pediatric Dentistry, again, recommends weaning away from nighttime feeding after about a year of age.
Right, for the benefit of the teeth. And then when is the best time to make sure that your kids are brushing their teeth?
I would like to typically have the child brush the teeth after the morning feeding and then after the evening feeding. So twice a day, typically in the adolescent, the later child adolescent range, typically about 2 minutes for each brushing.
Okay, and that's an important, because 2 minutes is a long time.
Yes.
I mean, I see my kids in there. Now, can you, with children, because my daughter's 8 now, and she's really, because she had a cavity, so she's really brushing. Can you brush too hard? What do you have to be careful of? She's like really stroking it in there.
If you have your little one brushing their teeth and they're blanching the toothbrush where you see the brush bristles actually splaying out after several brushes, you probably want to back off. You just want a tad little bit of pressure on the teeth. Some of the electric toothbrushes these days, for example, the Sonicare has a 2-minute timer, so that's a good training tool so they get the idea of how long 2 minutes actually is. It actually beeps every 30 seconds, so you can kind of go quadrant by quadrant, 1 quarter by quarter. The Oral-B toothbrush, actually, for the adolescents and teenagers, if you put too much pressure on the teeth with the toothbrush, it'll actually flash a red light to let you know that you're brushing too hard. So it's a nice little oral hygiene.
So I've always heard that you should brush the way the teeth grow. Is that right in terms of the front teeth, or just straight across is fine?
I would probably do a circle and sweep up when I'm brushing the teeth is what I would typically do.
And what about flossing? Because this is,
yes.
it's hard enough to get the kids to spend the 2 minutes with
Correct.
the brush. And then here comes the flossing.
Well, that's very important because most of the cavities we see in the 3 to 8 year range actually occur between the teeth. So the flossing is really critical. Really getting between those last 2 baby teeth on the 4 sides of the mouth. Very important right there.
Now, there is a free dental event that's coming up, and these are always so popular and it's important. We've got a lot of the details, but why offer this? I mean, is it amazing how many children don't have good, proper dental care?
Well, there's an underserved population that would really benefit from the cavity protection. And this event is sponsored by the Jacksonville Dental Society at the Sulzbacher Clinic on Saturday, February 6th. And our goal is to provide as much free dental care that we can to the underserved population, including cleanings, dental fillings, dental extractions. We'll have probably 50 people from either dentist, hygienist, or assistants helping with this event.
And so kids can be pre-screened also. Again, this is Friday. It's at the Sulzbacher, and it's Friday from 10 to 3 is the pre-screening, right? And then, of course, there's the event then that's on Saturday. Now, what's the next Wednesday from 3 to 6?
That is also another screening event. What we're trying to do is figure out who will actually be attending this event so the doctors and the hygienist and the assistant can be properly prepared for the event.
What if you've not pre-screened? Can you still attend on that Saturday?
Yes. Now, it will be on a first-come, first-served basis. So if the child shows up with the parent and if they have not been pre-screened, we'll definitely try to work them into the event. But again, it's first come, first serve.
We're going to put all that information on news4jax.com. Dr.
Thank you
very much for being here.
I appreciate you having me.
Bruce?
Well, they can range